Good morning. We are thrilled to welcome you to our exciting new series, Moving Forward, Cognition and Cognitive Challenges in PD. This three-part series is brought to you by Parkinson's Community, Los Angeles, featuring insights from three speech pathologists. Today, we'll be hearing from Rachel Convey. I'm Suzanne Johnson, a PCLA advocate. For those who don't know us, we are a nonprofit that supports families living with Parkinson's through our free education programs like this one, online and in-person support groups, social events, and more. Today's conversation is made possible by important donations from people just like you in the Parkinson's community. If you appreciate our work, please consider making a donation at PCLA.org. Your donation is 100% tax deductible, so thank you in advance. We rely on your generosity to help us continue this important work. A few notes. We are recording today's event and will be posting it to our PCLA YouTube channel and the PCLA.org website, which are both incredible resources. Registrants will receive a link to today's presentation about a week from today. If you don't want to be visible, please turn off your video and stay muted to reduce background noise. After the presentation, there will be time for questions. You can also submit them during the presentation through the chat, and they will be addressed during the question and answer period or during the discussion if they come up. Presenter Rachel Convey, PhD, CCC-SLP, earned her Master's of Science in Speech Language Pathology from the University of the Pacific. In 2020, she was awarded a Fulbright Research Grant and conducted research on automatic speech intelligibility analysis in individuals with Parkinson's disease at Tampere University in Tampere, Finland. Dr. Convey went on to earn her PhD in logopedics, speech-language pathology, from Tampere University, where her research focused on acoustic analysis of voice quality and speech intelligibility in individuals with Parkinson's disease. Try to say that a couple times. Her ongoing research interests include developing objective clinical tools for early detection and monitoring of therapeutic outcomes in individuals with neurodegenerative diseases. She currently serves as Vice President of the Southern California Voice Foundation and works clinically as a speech-language pathologist at the California Rehabilitation Institute and Convey Speech. So let's get started. Dr. Convey.
Suzanne, thank you for that introduction. Good afternoon, everyone. I'm so excited to be here and get to talk with you all today about one of my favorite topics, which is speech and voice in Parkinson's disease. So during this talk, there are going to be some periods where I ask you to interact. Sometimes it's going to be typing a response to a question in the chat, and other times it's going to be interacting and participating verbally. But given that you're all on mute, it should be okay. So I give you permission to be as loud as you want to be during that time. If you're uncomfortable participating in the chat and you're sitting next to someone during the presentation, you can interact with that person and give your answer to them rather than providing it to the group. All right, so we're going to cover quite a few topics today. I want to start the talk by discussing how voice is produced, just the basic physiology behind voice production. I then want to talk about dopamine in the brain and how changes in levels of dopamine impact the function of certain structures in the brain as well as our voice. And this is just a very light overview, but I think it's really important that we understand how the physiology affects the symptoms we observe, because that affects the therapy that we give and the prompting that we give for the therapy. I know many of you participated in speech therapy for voice. I want to briefly go over the two therapy options, voice therapy treatment program options for Parkinson's, just in case we have some people attending who are not familiar. And then we'll transition into talking about the importance of practice, how to practice, when to practice to maintain that nice, strong voice that's developed. So given that this is my first talk and time working with PCLA, I wanted to give a brief personal background and talk about my experience with Parkinson's. So my grandmother, who's pictured here, Grandma Sandy, was diagnosed with Parkinson's when I was a child, and lived with Parkinson's through most of my growing up and young adulthood. And it's through her that I first became interested in studying Parkinson's, but most importantly, it really, my experience with her drove my outlook, both clinically and with research, to emphasize kind of this patient first, client first mentality. So, because of her, that I'm, striving to improve treatment options for individuals in this population. All right, let's talk about voice and how we make our voice. There are 3 components to voice production. The first component is respiration. We then have phonation and resonance. All right, so what is respiration? Well, respiration is simply the act of breathing in and breathing out. When we breathe in, our diaphragm contracts, we have muscles that lift our rib cage, air flows into our lungs passively, and when we breathe out, we kind of exert air out of our lungs, and it travels through our vocal folds. And it's through this process of air traveling through our vocal folds, sound is produced. When air travels through the vocal folds, it causes phonation. It causes the vocal folds to come together and to start vibrating, and that gives us sound. Now, at this point in the process of voice production, we can kind of correlate this to either like a trumpet or a clarinet, right? Both of these instruments have mouthpieces, and it's kind of like just blowing through the mouthpiece out, having the rest of the instrument there to give the sound its unique quality of either being a trumpet or being a clarinet. That unique quality, that unique kind of characteristic sound to our voice, the reason we could recognize that, oh, that's, my spouse on the phone or my child on the phone, is because of resonance. And our whole head acts as a resonance chamber. So we have some cavities, right? We have our oral cavity and our nasal cavity, and it's through this filter that we have that gives our voice unique characteristics. So the power of our voice is the respiration, that exhale. And when we speak more loudly or with more effort, it requires kind of a more forceful exhale. All right, so let's start talking about Parkinson's voice now. This is quite an important topic. We know through research that approximately 90% of individuals diagnosed with Parkinson's will experience. Now, these changes that are experienced in speech and voice are given this kind of umbrella diagnosis, and that diagnosis is hypokinetic dysarthria. So there are many different types of dysarthria, and each type of dysarthria has its own characteristics and is influenced by the point of injury or the disease that's causing. In the case of Parkinson's, we see this hypokinetic dysarthria, and we can divide the characteristics into three categories, 3 aspects of communication. The first is voice. So one thing that's very common is to have this reduced vocal loudness or this mono loudness. So very quiet speech, difficult to hear. We see monotone. So there's decreased variability in the pitch, in the tone during sounds very, very flat. We also see this development of this hoarse and breathy vocal. So we have kind of extra air coming through. It's a little bit rough, and all of these are characteristics of the voice changes secondary to hypokinetic dysarthria. Then in terms of articulation, we see imprecise consonants. So speech is a very fast, highly skilled fine motor tasks. And our articulators, our lips and our cheeks and our tongue have to hit the exact spot in our mouth at the right time in order for the sound to sound crisp and clear. And with this imprecise articulation of consonants, we can sometimes sound unclear, maybe a little bit mumbled speech, decreased speech intelligibility. When we look at the vowels, we see vowel centralization. So we use our whole mouth to shape and form the sounds when we're saying vowels. With individuals with hypokinetic dysarthria, we see that the range of motion that's used to shape vowels narrows and it becomes much more limited. So the movement, similar with the consonants, the movement of our lips and our tongue and our cheeks is limited. And then in terms of rate and prosody, we see changes in speech rhythm, often characterized by short bursts of. So together, these symptoms are characteristic of hypokinetic dysarthria. It's important to note that not everyone, as we saw in the previous statistic, not everyone with Parkinson's will necessarily develop hypokinetic dysarthria, although a large portion of the population will. And it's especially important to note that not necessarily all of the symptoms of hypokinetic will be experienced by each individual. So sometimes someone's voice stays really loud, but they experience changes in their articulation. So it really is variable. All right, thank you all very much for sharing. It's nice to see that other people are experiencing similar things and similar challenges in terms of communication. All right, let's talk a little bit about the brain and how Parkinson's impacts certain structures. So this is the basal ganglia, the structure that's colored here, it's highlighted. And this is kind of the main player in Parkinson's. And we're going to talk about two of these substructures. Talk about the substantia nigra and the striatum. See here. All right, so the substantia nigra is where we have dopamine production. And dopamine is that critical neurotransmitter in Parkinson's, and it plays a role in movement control, cognitive functioning, and the emotional limbic. The striatum, which is highlighted in green controls goal-directed habits and acts. And this is really critical. This will become really critical when it comes to discussing practice and establishing a practice routine, because the loss of dopamine causes disruption to the function of this structure. And so we have, just because of the physiology, motivation becomes a little bit harder because of the disruption and loss of dopamine. All right, we have two motor tracks, and these are pathways, neuronal pathways, that send signals from the brain to the lower motor neurons, which then help us control our muscle. The first pathway that I want to talk about is the extrapyramidal tract. This involves the basal ganglia. So as it travels through the brain, it goes through the basal ganglia. This tract is dopamine dependent, meaning that in order to function properly, in order to work as it should, it requires dopamine. And this tract controls involuntary actions and movements. So what's included in this category of involuntary actions and movements? Things like walking, things like talking, writing, actions, motor actions that don't even have to think about, that you can just kind of do automatically. All right, now we have the second motor tract called the pyramidal tract. This pathway circumvents the basal ganglia. So it doesn't go through the basal ganglia, it goes right from the cortex to the lower motor neuron, and it is not dopamine dependent. It does not need dopamine. This tract controls voluntary actions and movement. And so these are actions that you really have to think about, kind of like learning a new skill. If you're learning a new sport or a new hobby, the motor movements don't come automatically or easily right away. You really have to focus on it and make, approach the movement with intention in order to do it correct. All right, so we have these two areas, the extrapyramidal tract, which is dopamine dependent, and controls involuntary action. And we have the pyramidal tract is not dopamine dependent and it controls voluntary. And so my hypothetical question to you, you're welcome to answer in the in the chat if you want. There's absolutely no pressure to. I want us to think about why the prompting to speak with intent or to think loud as an LSVT, why does this prompting work for individuals with Parkinson? Well, this prompting allows us to take an involuntary act, like speaking, and make it voluntary, which means it has to be to some degree effort. So by focusing on speaking with intent or thinking loudly, speaking loudly, we're able to engage the pyramidal tract, which is still intact because it's not dopamine dependent, and we're able to produce a nice, strong, loud. There is one other aspect that I want to talk about before we begin discussing voice therapy itself, and that is sensory feedback. So I've included a quote. I really like this quote. It's from an older study by Hammer and Barlow done in 2010. And I'm gonna read it out for everyone. Individuals with Parkinson's often report that they feel as though they are shouting, or they feel as if they are exerting great physical effort when asked to speak at a more normal audible loudness. This clinical observation suggests that speech and voice impairment and Parkinson's may be related to impaired somatosensory function. The study went on to find that individuals with Parkinson's had a greater laryngomechanosensory detection threshold. All right, what is that? The laryngomechanosensory detection threshold is the amount of stimulation needed in the larynx, so in your throat where we produce our voice, in order to elicit a response. So in individuals without Parkinson's, the stimuli needed was significantly less than those with Parkinson's. Functionally, what does this mean? This means that even if you're speaking at a normal level of loudness, it's going to feel your feedback, the feedback that is received is not necessarily reliable. And so we get this kind of decrease in voice and vocal loudness. This is quite an old study, and I included a citation below from this year, just to illustrate that there is ongoing research about this somatosensory function in Parkinson's and this kind of change in feedback experience. And so with practice and with the voice therapy, the goal is to kind of know what speaking at a normal level of loudness means and what it feels like. It's going to feel different than it did when you were younger. Okay, what are the voice therapy programs for PD? Well, I know that many of you, in talking with Julia, are receiving speech therapy, but just for those who might not be too familiar, I want to talk about the two main speech therapy program for individuals with Parkinson's. The first one that I want to talk about is the Lee Silverman Voice Treatment Program. This program was developed by Dr. Ramming and Dr. Fox. It is one of the most thoroughly researched programs. It's been studied for over 25 years, and they have there's a couple tiers to this program. So they have LSVT Global, which is the larger company. They have LSVT Loud, which is the speech therapy program. And they have LSVT Big, which is the physical therapy program. All right, so what research has been done on LSVT? Well, several randomized controlled trials, which is the kind of the gold standard of research, has been done with this program. One of the controlled trials, which was done in 2018, looked at 3 population groups: individuals who received LSVT Loud, individuals who received LSVT RT.
You need what?
Possible to move this.
And an untreated population group. The next study looked at intelligibility at the single word level, so not kind of this global impact of the program. And again, it was the same population group. So does focusing on being loud, is that more effective, or is focusing on articulation precision more effective? And both studies found that the LSVT loud was impactful, it was effective, and it had greater results in terms of loudness and intelligibility, both 1 month after therapy and then 7 months after. All right, this is the basic structure to the session. I'm going to move forward just for the sake of time, but the PowerPoint will be available afterwards. The next therapy program is Speak Out. So Speak Out is kind of made and run by a company called the Parkinson's Voice Therapy Project. This was founded in 2005. Speak Out was founded in 2010. And they've just kind of revamped their therapy model. So now, instead of the loud crowd, we have Speak Out therapy groups, and we have the Parkinson's virtual. The research that was done, this is the therapy program that my grandmother went through, and this is her completing her daily exercises. The research, like LSVT, supports the efficacy of this treatment program. So both options are valid and viable and backed by research, and both show kind of long-term efficacy given the continued practice tune-ups. And this is the basic structure to the Speak Outs. So both include some form of warm-up, both include a reading task, and then and the following task is either cognitive or talking at various levels of difficulty. All right, so where to get therapy? Well, there are a multitude of settings that are possible: university clinic, outpatient hospital settings, home health, private practice. To some degree, all these settings offer services, Parkinson's voice therapy services, and there are two options as well in terms of how you receive the therapy, whether that's in person or via teletherapy and telehealth. There was a lot of research done both during and immediately after COVID that showed that yes, teletherapy is a valid speech therapy. So if it is harder to get out of the house, or if you have a therapist who's in a different part of you find a therapist you want to work with who's in a different part of the state, or a different city than you're in, teletherapy is a perfectly valid treatment mode for this program. Now, how do you find a certified provider? I really want to stress the importance of working with a therapist who is certified in the therapy program you're wanting. Whether this is Speak Out, whether this is LSVT, it's really important that the clinician is trained and certified. During this therapy program, we're listening for a lot more than just, are you speaking loud? Right? There's a lot going on behind the scenes, and we don't want any more damage or strain to be put on your voice. I've included the links in this here, both to the Speak Out Find a Provider webpage and the LSVT Find a Clinician webpage is how they're referred to with that program. And with both options, you're able to type in your region and see who around you or what clinics around you are both certified and providing service and how they're. All right, so we're going to move on to talking about practice and the importance of practice. And let's start by actually practicing together. So if everyone can kind of do a double check, make sure your microphones are off so that we can be nice and loud and not too disruptive. And we're going to practice saying a phrase together with intent, with this loud voice. It's important that we differentiate between shouting and being loud. So we want to have this loud, strong voice, but we're not going to yell during this. All right, so if everyone can sit up straight, knees bent, nice and tall, we're going to take a deep breath, and together we're going to say this phrase. We'll do it 3 times. We're going to say it with intent. All right, you ready? Number 1, please pass me the phone. Please pass me the phone. All right, last one, number 3, please pass me the phone. Nice and loud and strong. All right, now we're going to keep the same phrase, but we're going to mix it up a little bit. So instead of just saying the whole phrase with emphasis kind of evenly dispersed, I want us to practice placing the emphasis on different words. So with the first sentence, we'll place the emphasis on please, and then pass, and then me, and then phone. All right, here we go. Number 1, please pass me the phone. Okay, 2, please pass me the phone. 3, please pass me the phone. Good. All right, last one, number 4. Please pass me the phone. Right. Excellent, excellent. So let's talk about practice and why practice is so important. I want to kind of circle back to the very beginning when we were talking about the basal ganglia and the structures in the brain that are impacted by the loss of dopamine. So the striatum is one of those structures that's part of the basal ganglia that's disrupted by the loss of dopamine. And this is the structure that controls goal-directed habits and acts. All right, this, in the context of practicing consistently, contributes to a lack of motivation. And this lack of motivation can make practicing consistently really, really challenging. So it's kind of this negative cycle of decreased motivation, which results in decreased practice, which then might again result in further decrease. And one way that can help with this, to help kind of keep the motivation there, keep the willingness to practice there, is to build practice into your daily routine. Almost make it harder not to practice than it would be just to sit and read through a sheet in your Speak Out workbook or read a piece of text for 5 or 10 minutes. So you want to build practice like a habit, kind of like brushing your teeth, right? You wake up in the morning, you brush your teeth automatically, and you do your voice exercise automatically. One way to do this, well, there are a couple of ways, but is to have the material easily accessible. So maybe you keep the material on your kitchen table, and in the morning, when you're making your coffee and the coffee is brewing, you sit down and you practice for 10 minutes. And then by the time your coffee is ready, you're done for the day, right? You've done your Speak Out exercises or your voice. Another way is to just build it into your routine. So maybe doing these exercises in the morning doesn't work with your schedule, but you leave it next to your chair at night. And so when you come home in the evening, you sit down and you do the exercises. Building it into your routine, making it easier to practice than not, will help maintain that consistency. So important in maintaining skills that you develop. All right, well, where and when should this practice take place? It's important that practice is more than just those 10 minutes a day, right? You want to speak with a loud voice. You want to be understood more than just those 10 minutes a day, because what you have to say is important. And so we want to practice in different settings to support generalization. Sometimes if we practice at the same spot on the table every day, it can get easy to only use our loud voice in that very specific setting. But when we go out to coffee with friends, we're not able to kind of engage in that loud voice. So by practicing in different settings, you get comfortable using these skills in a multitude of different social. So this could be as simple as practicing in different rooms in your home, practicing in different social settings. Maybe you have a weekly get together with friends for lunch, and you say to yourself, okay, this is my time to practice my loud voice in this social setting. Practicing in loud environments can be helpful. If you're at a coffee shop or a store that's playing background music, practicing kind of projecting your voice over the sound of the music or talking in the background so that you can be heard and understood. And then practicing during phone calls. This can often be quite a daunting task to have a conversation over the phone because we lose so many of those visual cues that support communication. But maybe starting with someone you're comfortable with, someone who's familiar with you and familiar with your voice, that you would be kind of willing to give a go at over the phone, and then kind of expanding that. One thing that we see in the the progression of the treatment programs is this increase of cognitive load as the program progresses. All right, what is cognitive load? Cognitive load is the demand placed on kind of your thinking and your attention and your focus. So if we have you just reading words and using a loud voice reading the words, that's a pretty low demand cognitively, right? We're just reading the words and going. But if I ask you to do math problems for me, or to name cities in a given state, we're increasing the cognitive load, kind of pulls your focus from speaking loudly, and that's where the challenge lies. So can you maintain this loud voice that you worked hard for with increasing cognitive load? All right, how do we practice? Well, you can talk with someone about a TV show or a movie that you watch. You can discuss a book. You can discuss recent events. You can talk through a puzzle. Anything that requires you to think about something else rather than just speaking loudly, right? So you get practice with that challenge of processing information, thinking about something with effort, and talking with effort. All right, I also want to make sure that you guys are aware of this wonderful resource provided by Speak Out. It's a Speak Out home practice. I've included the link to the webpage here. The practice sessions are live. It's a live kind of interactive video every weekday at 10 a.m. Central. So the Speak Out Parkinson's Voice Project headquarters are in Texas in Central Time. And this is what the page looks like. So you'll open the link, you'll get to the Speak Out home practice sessions. There's a countdown to when the sessions are, and you're able to join the sessions from here. But if you're not available every day at 10 a.m. Central Time, you're in luck, because scroll down on this page. They have recordings of these exercises. So they have the previous, couple days recordings available that you can watch and participate in and interact with. But they also provide reading material, which is in that column to the right. And these are PDF files that are, have a certain theme. Maybe they have you read a poem. They might include a cognitive exercise or additional voice exercise with emphasis. They're all a little bit different, but this is great, accessible practice material in case you want to keep it fresh and new with the work at home. Okay, going back to speech and voice, I really want to emphasize the importance of feedback. I'm sure to some degree you've experienced people, asking you to repeat yourself, asking you to clarify what you've just said, or not being able to hear you. And this feedback is really, really valuable, because it tells you that, okay, I'm not speaking loud enough for this person to hear me. Let me really focus on using my loud voice. In kind of line with one thing that you can do if you're comfortable with it is establishing either a code word or a gesture with friends or family or a spouse, someone who you would be receptive to taking feedback. Because I really want to clarify that we don't want to create kind of an environment of nagging, right? Speak louder, but rather create and foster this environment of support. So when would this code word or gesture be used? In really important social interaction. So if you're at a family party or gathering with friends and people aren't understanding you, maybe it's, this person can signal to you in some way to use that loud voice and speak up so that you can be heard and actively participate in the event and in the interaction. And lastly, I really encourage you all to advocate. If it's during an interaction and you kind of need more time to gather your thoughts, or you're having a difficult time thinking of the word you want to say, kind of, having to take those extra breaths to support that increased vocal loudness, being comfortable saying, please give me a moment, take the time that you need so that you can participate in the interaction as you want to. You can get your ideas and your thoughts without being cut short in any way because of this, tendency to have fast-paced talking interact. Okay, the last thing I want to discuss here is how to set yourself up for success for an important conversation or an important interaction. So just like any athlete would warm up before a big event, it's important that we warm up before a big talking. So if you're if you're going to be in a situation where you want to use your loud voice, whether that's having an important conversation, you have to make an important phone call, maybe you have family coming over, do your warm-ups before the event. Kind of get in the mindset of speaking loudly. Practice using your loud voice so that it's warmed up, strong, it's ready to go, and you know that it's there. During these conversations, these interactions, limit distraction. So this means no multitasking, focus on the conversation, right? Because we already have that pull, that demand of the increased cognitive load, but we also want to make sure that there's enough space for you to focus on speaking loudly while participating in the conversation. Think about talking and communicating while you're participating. This should be effortful to make sure that your voice is nice and loud. And most importantly, I think, make sure that the environment is modified to support you during this interaction, right? So turn off the TV, turn off the radio, make sure there are limited visual distractions, right? So just having the TV on mute isn't necessarily enough because you can still kind of get pulled to the side looking at the image. All right, and lastly, the last kind of suggestion here is to use visual reminders to help you speak with intent. So this could be a note on or near the telephone, whatever kind of visual reminder works for you and reminds you that, okay, I need to, put effort into my voice, speak loudly. And this could also be a place in your home where you do a lot of talking or interacting. So maybe next to the dinner table, it's helpful to have, use your loud voice post in your eyesight, in your gaze, so that you can fully participate at, dinner table conversation. You can be heard in this really important interaction. All right, on the next slide, I have included a list of the references that are noted throughout in case anyone has any interest in exploring this research a little bit further. And that is it for me. Thank you all for your attendance and your active participation.
Thank you so much, Dr. Convey. What a great presentation. We all really appreciate that. And there's so much information that you shared. Let me bring some of the questions and comments to you. One person mentioned that he has success with intent with his handwriting. So would you consider that a prompt?
Yes, absolutely.
Okay.
Absolutely. So any external input, whether that's visual or verbal or tactile, is a prompt. And so that's wonderful if you've discovered that using that mindset of intent works with increasing the legibility or the size of your handwriting.
Oh, okay. Thank you. Now, another person said, just like motor slowness, you put out the same effort and get less result. And that would be from the less dopamine. So then you have to activate the non-dopamine pathway.
Yeah. So these motor neural tracks are really, they're really something. And it's kind of like all important structures in the body. We have two of them that do relatively similar things, right? 2 kidneys, 2 eyes, 2 motor neural tracts that help us executing action. And so by putting intent into walking or communicating, I know a common prompt is to walk like a CEO or talk like a CEO, kind of assume this position of power, helps engage the pyramidal tract, which controls voluntary movement, and it's still intact.
That's so interesting. Thank you. Now, Helene wrote, I noticed dysarthria about 1 to 2.5 years after receiving BS surgery. My speech was great before receiving, scroll down here. Okay. Operator error here. Before receiving DBS. Any correlation between the two?
You know, I'm not a medical doctor, so I am not in the position to answer that question, and it could be variable, right? Because we know there's still the progression of Parkinson's. So I'm not in the position to give a sound kind of thorough answer to that question, just because it's not my specialty. But you know, it depends on a multitude of things. Yeah.
Take that one back to your doctor, your
Yes.
movement disorder specialist. Okay. Do SOLA and LSVT have the same physiology?
Sola. I'm not familiar with Sola.
Speak Out LA. Speak Out Los Angeles.
Oh, Speak Out Los Angeles. Thank you.
And LSVT?
The Lee Silverman voice
Yes,
treatment.
right.
Okay, so do they have the same physiological,
They
you know,
affect the same,
mechanisms?
they affect the same areas.
Ah, yes. Thank you for clarifying. Yes, they do. So you notice that the exercises, especially with LSVT and Speak Out, they're very similar, the exercises that are addressed. And it's really this prompting to speak with intent, and doing these exercises to work on different parts of the communication. Prolonged vowels help with breath support and that sustained phonation. The glides address pitch range. So all of these exercises are relatively common in their use with Parkinson's voice treatment, but it's really that prompting to speak with intent and to bring intention.
Does LSVT also have daily online home practice like PVP does?
I'm not certain. I have not heard that they do, but that does not mean that they haven't developed it.
Now, Robert's got another question. When in a loud situation like a restaurant, I try to be heard by using maximum force. Is that on why?
It depends on what you mean by maximum force. Like I said, we don't want shouting, right? We don't want to be yelling, because that causes increased strain, and that could potentially become habitual, that we get used to, rather than speaking with a loud, strong voice, we're shouting all the time. And that can cause difficulty and problems to our vocal folds. These are such delicate muscles. And so even in, if you have the Speak Out workbook, it's also in the therapy protocol for both Speak Out and LS. There is a limit to how loud we want you to be during our. And so once you kind of cross over that 85 decibel level, the guidance is to make you not so loud, that's too much. And so if you're in a busy restaurant, noisy restaurant, which is an incredibly challenging environment to speak loudly and focus in, I would recommend positioning yourself so that either you're seated close to the person you want to be talking with, or close to the one you're having the conversation with, and modify it that way to support your voice, so that you're not shouting. That is not advised.
Very helpful. Thank you.
That is. And I think that answers, Bruce, your question about engaging when you try to speak quietly and it comes out very hoarse and you have to raise your volume to engage your vocal cords.
Yes.
Okay.
Well, as I'm sure you know, speaking loudly takes effort, and it's that effort that is needed in every single interaction that you have, right? We can't just put in effort when we're practicing and then forget about it when we're talking with our spouse or talking with our friend, because our voice is going to fall back down, right? We have to use that effort and that motivation to engage that pyramidal tract and to have our voice be loud, right? Not shouting, but loud.
Is one of the programs considered better or easier to maintain?
I think, well, it depends. So it depends on your abilities. LSVT is 4 sessions a week, 1 hour a day for 4 weeks. So it's quite condensed, quite intense. Speak Out, on the other hand, has a recommended total amount of sessions you should complete, but the frequency per week changes. Both involve continued practice and, work on your voice after the program ends. But it really is kind of, I guess, up to personal preference and accessibility. That is, there's someone close to you who's providing the service, because both through research have been shown to be
Thank you. Okay, so it's a bit of a personal thing.
yeah,
then.
it's gray. It's dependent on the
Okay.
situation.
Can you speak to, and somebody did put in a comment about this, and I think probably everybody has this, is what happens, or what recommendations can you make for people who kind of lose their motivation, don't practice as much, and then kind of, start disengaging? How can we help motivate these folks?
Yeah, that's quite the challenge. And it's easy, I think, if speaking loudly is difficult or challenging, to avoid it, to not do it, because it's hard, right? It's really hard to do. And it's work, it's effort, and so it might be easiest to turn away. But I would recommend kind of developing your reason as to why you want to interact, why you want to maintain your loud voice, right? Do you want to have conversations with your grandchildren? Do you want to be able to keep seeing your friends that you've been having lunch with for several years? So finding that why and that purpose to put in the work can be motivating. On a kind of a more simple level, you can reward yourself for practicing. Maybe if you practice after your cup of coffee is brewed, the cup of coffee is kind of your reward for doing your 10 minutes of practice, right? That's something that you look forward to doing, that you want to do. You want to drink this cup of coffee in the morning. But first practice and then coffee. So it's really, it comes down to finding what's motivating for you and leading into.
Okay, and I think that's important. We need to keep recircling and revisiting what our motivators are so that we don't lose track of why we're doing this.
Exactly.
So, couple of other questions I just want to touch on. Pat Young asks if voice therapy helps with breathing.
Well, it helps with, in a way, yes. It doesn't directly target breathing, right? So we're not focused on practicing inhaling and exhaling, but through exercises like the awes, like the prolonged vowels that you have to hold out with this nice strong voice, our ability to do that and our ability to sustain the vowel for maybe 5 seconds at the beginning, and then by the time we're done with the program, we're up to 30 seconds, is working on that breath support and improving our ability to take a deep breath and then do this. We call it the checking action. Release only the necessary amount of air at a time to make our voice loud and sustain it over a prolonged period. So that skill can be developed through the therapy programs, but it's not directly targeted.
Okay, so it might be a byproduct, kind of a collateral improvement.
Yes.
That's nice. Somebody asked a question about CCA. What is your opinion of CCA devices?
CCA, that's the auditory. I just want to clarify that I'm interpreting the acronym correctly. That's the is that the earpiece amplification?
I don't know. Let me just come back to this.
That's the keyboard that you can speak to.
Oh, the AAC device.
Oh, okay.
Yes. Okay. I think AAC devices are great. And if AAC devices help support your communication and your willingness to communicate and get your point of views across, then they absolutely serve a purpose. But I encourage, if you're able to use your voice and if you're able to still communicate verbally, to try to do that first and use the AAC as a supportive device. So if you don't have to be fully reliant on it, try to avoid that. But I absolutely think AAC devices can be wonderful and can allow you to communicate.
Very good. Thank you. And I know that we have to wind up. I'm getting a lot of wonderful feedback here from everybody. What a fantastic presentation. Going to the YouTube channel for this information and more. Is there anywhere that our participants can go online to find these training programs and supports, or do they need to go through one of the programs?
So it is, you do need to go through one of the programs to get the therapy. So doing the online home practice through the Parkinson's Voice Project is not enough. That doing this program, whether it's Speak Out, whether it's LSVT, is crucial for building that foundation of skills, and especially crucial for getting that feedback. So remember, because of Parkinson's, your somatosensory feedback, the feedback of your voice is different. And so in order to make sure that you're applying these skills in a healthy way, you're actually speaking with increased vocal loudness, you're not just shouting, going through the therapy program and then using the home practice to supplement and sustain the skills you've learned in therapy. But there is so much value to going through one of these.
Thank you. And thank you so much. This was just a wonderful presentation. And we want to extend a big thank you to you, Rachel. That was just absolutely wonderful.
Oh, it's been my
And
pleasure.
yes. And thank all of you for joining us today. And if you enjoyed today's program, we invite you to visit PCLA.org and make your donation today. Your support helps us continue our mission to improve the lives of families in our community affected by Parkinson's disease. For more information, please refer to the contact details on this screen. Remember, PCLA is a nonprofit organization and all donations are tax deductible. Thank you for joining us and making a difference. And please join us virtually on October 16th for the third part of Moving Forward, where we discuss swallowing difficulties in PD with Sophia Rogers, SLP. Also, our in-person fundraiser, Let's Taco Parkinson's, is taking place on the evening of October 16th at El Granjero Cantina at the Grove Farmers Market. A link to register for these events, as well as updates for all of our programs, will be sent out through the email and on the PCLA website. Thanks, everyone, and have a wonderful day.
Thank you.
Thank you.
Thank you all.
Thank you all for joining us.